In the name of God, the Beneficent, the Merciful, today I would like to speak about mycotic pneumonia. As you can see here, there are several focal lesions on the different lobes of lung, cranial lobes, middle lobe, and diaphragmatic lobe. And the other lung of this sheep has the focal lesions. You can see here on visceral pleural surface of the lung. What's your diagnosis based on these focal lesions? These photos are sent by one of my colleagues, Dr. Torkaman. My diagnosis and his diagnosis were a parasitic pneumonia based on these focal lesions. How about you? Do you agree with us? When I examined histopathological slides of this case, it was really surprising. In this slide of the case, as you can see here, there is pseudostratified ciliated columnar epithelium of the bronchus. Here you can see the bronchus cartilage, but the other side there is severe necrosis of the epithelium. You can see here, and there is severe infiltration of inflammatory cells and hyperemia. This photo is higher magnification of the previous photo. This slide shows a longitudinal section of mycotic hyphae here, and this part. You can see fungi hyphae. So I called it mycotic necrotic bronchitis. In periodic acid sheath staining, you can see the hypha red, longitudinal section, transverse section of the hyphae is like a circle. There is numerous sections of hyphae. This part you can see the cartilage of the bronchus. Think about this structure. What's this central area from here until here and from here until here? How about these lesions? As you can observe here, I called it necrotic vasculitis due to fungi infection. Here you can see intact tunica media of a small to medium artery, but here you can see severe necrosis and infiltration of inflammatory cells and thrombus formation. This section is stained with PAS, periodic acid sheath. You can see fungi hyphae here, longitudinal section here, and embolic hyphae within the artery. You can see the red blood cells green in PAS staining method. Again, you observe higher magnification of the previous photos, red blood cell within the artery, severe artery wall necrosis, and deposition of eosinophilic materials here. So I called it fibrinoid necrotic vasculitis. Around the vessels, you can observe longitudinal and transverse section of the fungi hyphae, and these green structure are red blood cells. Here, here. In other words, there is severe hyperemia. This photo is higher magnification of the previous photo, and again you can see numerous fungi hyphae, longitudinal section, branching point, and transverse sections of the hyphae. This case was an interesting case that macroscopic and microscopic lesions were very different. Thank you very much for your attention. Take care.